Hey guys, this is Peter with PT Approved. In this video today, I'm going to discuss kind of your expectations after you've had knee surgery or arthroscopic meniscus repair or a meniscectomy. Obviously, if you're scheduled or if you've had the surgery, there's a few things you need to be aware of. Obviously, you're having surgery because you have a meniscus that's torn, and it's such where it won't heal by itself, and you're having extreme amount of pain. Your knee might be buckling under you or locking up, and it's just extremely painful to either twist on the knee as well as walk. So if you're going in for surgery, some things to take into account. Expect that you're going to definitely have some stiffness, some minor pain, and swelling in your knee joints. So make sure that you have adequate ice at home, that you're ready to go and to ice the entire knee, front, sides, and back, and also that you're going to need some pillows that you need to elevate your leg on if you're sitting a lot and watching TV, for example. We're going to be going into the exercises or the rehab itself here in just a few pages, but just be aware of that. Also, if the doctor is going to be prescribing pain medicine, make sure that you don't have allergies to those and that you're able to change it up if you're having issues with it. Many people have nausea or stomach issues such as constipation, so you want to take that into account. Okay, so after you've had the surgery, you're going to be sent home, and you're going to have quite a bit of swelling. So the first thing is to control the swelling in the knee joint. So you need to be aware of that. By the way, I'm at this accesssportsmed.com website right here, so I just wanted to give them credit for this good article. Make sure that when you come home, immediately you elevate your leg and you ice your knee, and over the subsequent days that you take it easy and that you don't go crazy as far as walking just on the knee with full weight. Make sure that you have adequate devices to help support your walking, such as using a walker or crutches. Typically when you're younger, you'll be using crutches or a cane. If you're older, a walker sometimes works better. So and the assistive device is there just to basically buffer your weight so that you don't injure the knee further, because it is going to be very tender and there's going to be a lot of inflammation inside your knee joint from where the doctor did the work. So just take that into account. So weeks 0 to the second week. Alright, so range of motion, aside from controlling the swelling in your knee joint, the therapist at the clinic is going to be working on getting your knee bending a little bit better. So 0 to 125 degrees. This is important to note because you don't want to be fully flexing your knee at this stage, because when you flex your knee to the extreme, it's going to put a huge immense amount of pressure on the meniscus area, and where the doctor did the incision, that's going to aggravate it. So you don't want to do that. So the therapist will guide you on the appropriate amount of bending in your knee joint. They'll be working on things such as strengthening your quadriceps, working on your posterior chain such as your glutes. Ankle pumps are very important. That helps with circulation and reducing the swelling in your calf and your thigh and obviously your knee. Straight leg raises works great on strengthening your quads. Be doing some knee extensions such as sitting on a chair or over the edge of a bed, and just basically working the knee up and down from 40 degrees to 90 degrees. Also, the therapist might be working on loosening up your kneecap or your patella, and then heel slides as appropriate. You have those small little mini bicycles. Those come in really handy for you to sit on and then just do a little pedaling motion, and that'll be a great help as far as starting to increase circulation in your knee joint. Squats you need to be careful of. So initially, just bending your knees in a squatting fashion down to 30 degrees. So just keep that into account. From the second week on, it's expected that your knee is going to be bending to normal. So full range of motion is going to be expected. Going to be going on doing step-ups. Going to do stationary mini lunges, so standing and lunging forward. going to be doing some standing hamstring curls, wall slides, where you lean against the wall and you just bend your knees and you slide up and down. From week 4, you're going to be continuing with all the same exercises. In addition, you'll be doing deeper squats. You'll be getting on a stepper and probably on a stationary bike. Lastly, from weeks 8 to 12, they might start you on some light jump training, elliptical trainer, some agility exercises, and then from week 12 you should be back to full function in your knee joint with appropriate strength and coordination, and you should be getting back to running. So I know this was very brief. I hope it's helpful. For more information, obviously I think this is the link right here if you want to just take note. If you are going for surgery, good luck. If you've had surgery, this is something that you can use as a measuring stick to see where you are as far as what your therapist is doing. Again, the information here is just for educational purposes. I'm not advocating or telling you what should be done. This is just as a reference if you're going through this kind of experience. Good luck, and I will speak to you soon.